And this type of learning is the type of learning we would like to gather through SHINE, through the online discussion. What I'm going to present to you now is learning that we've gathered through focus groups, which won't stop, but we want to supplement it with the new normal, which is online communication. So now I'm going to present to you what our learning has been from the UN Trust Fund, specifically on COVID-19. And this paper has just been published on our website, and we'll put the link into the chat. And it is a special paper in a series of 10 knowledge briefs that the Trust Fund has been developing with civil society on learning from practice. And we've been gathering data, evidence, and knowledge from our portfolio of over 250 civil society practitioners over the last few years, which, if we recall from the beginning of the session that Vesna and Aaron put a focus on, that we really put a value in the practice-based knowledge of civil society, which we've learned from many other civil society organizations themselves in the Global South, such as Raising Voices. So I would like to acknowledge them. Our focus in the Learning from Practice series on violence against women is to amplify the contribution of civil society and women's rights organizations in the response to violence against women and prevention. We also want to do this through SHINE. So this is an example of what we can produce through SHINE. We want to promote the practice-based knowledge as a complement to the rigorous and more scientific-based evaluations and research that are out there. We feel it can be a complement to existing policies and programming, and really important influential pieces such as the recent WHO and UN Women prevention framework called RESPECT. The work with practitioners can supplement this with the how to do violence against women prevention. In looking at prevention of violence, we discovered through a synthesis of over 89 projects, 10 key themes that were common across our portfolio of 89 projects, thanks to the feedback from civil society, and you can see them on the page. What's interesting to me is that many of these topics just came up in the chat during this 2-hour session. I saw many questions about how to engage faith-based actors, how to work with belief and religion and cultural systems, how do we mobilize communities, how do we protect women through laws, policies. So we have been extracting this knowledge that is out there from civil society. So please do take a look at the evidence that's gathered already and add to it, including through SHINE. This is just to note and acknowledge all the 89 civil society organizations that contributed to this study. You can see them briefly on this screen, a real global effort. And what we found through our study on these themes in prevention, that the pathway to prevention of violence is often messy. It is not a linear journey. Civil society practitioners are starting with the route of mobilizing communities and finding, for example, the need to engage faith-based actors, or the need to work intentionally to develop their training manuals for behavior change. And then suddenly they have to adapt to crises, which is just what we heard from our panel. So a huge common theme throughout all our prevention studies the last 2 years was the huge impact of COVID-19 and the pandemic. And that is why we produced one paper just on this theme across all the other prevention themes. What did we learn? Well, we're hearing from you, and we heard it again, that civil society are at the front lines, seeing the impact on women and girls on a daily basis. They're seeing an impact on their ability to mobilize and engage women and girls in prevention work. you're seeing the pandemic still have an impact on your ability to mobilize communities, which is key to prevention. And still on a daily basis, you're seeing the impact of the pandemic and other crises on the ability to deliver services for survivors or to make sure that laws are actually implemented for prevention. And a common theme throughout is the importance of investing in civil society's own organizational resilience and ability to adapt, and the fact that the expertise is there and civil society are doing it on a daily basis. We heard today, and you hear it again, that COVID-19 and other crises are deepening marginalization and making women and girls invisible, particularly to service providers who need to know where they are and to be able to reach them. Risk factors are heightening, schools are closing, economic pressures heightening. And because of this, and because of the pandemic, it becomes even more important to integrate prevention and response within other humanitarian and emergency response. So we have seen civil society pivoting to provide that emergency response. And this is both a positive and a negative, because the challenge as civil society move to emergency measures means it's harder to maintain your prevention activities. But the women themselves and the girls who are already engaging and mobilizing as agents of change have played a hugely effective role in both pandemic response and keeping prevention projects on track through women's own leadership and role in the community. And in each of these slides, you will see a quote on the right from one of our civil society partners about this topic. Second in our 4 key findings is that despite the problems of the pandemic, despite the inability to reach communities, civil society are valiantly doing so. You are still engaging community actors. And sometimes this has meant getting hyper-local and putting yourselves at harm's way to reach communities. So we see a lot more local activities, youth activities. And on the other hand, we see activities moving online. And we all know now the challenge of moving online that has both positives and negatives. Messaging has been so important to continue that dialogue with communities about interaction and intersection of pandemic response and prevention of violence. And it's been so important to keep an eye out on whether funding has been redirected to COVID response at the detriment of prevention. And so you, civil society, have been on top of all these issues, and we can learn so much. Finding 3 of 4. The impact on service has been great, and it still continues to be great. There has been huge challenges and well documented that the services were no longer available. The essential specialist services were no longer available due to public health measures. But civil society were there, and they adjusted and they adapted, and they still delivered for women in terms of helplines, support to survivors. But a big barrier was that the government, the state did not always recognize the specialist services as essential. And so this messaging for the future, for future crises, is a key that this recognition is needed and that more strategic thinking is needed about service provision. The last key finding is, as I mentioned, the vital importance of building organizational resilience, investing in civil society to be able to adapt, because they can adapt. Despite all these challenges, innovation, creativity, opportunities, partnerships for collaboration have been found. And yes, digital tools like Shine are coming about to help us network and collaborate across language and physical barriers. But there are pros and cons to this. So there's a responsibility on donors and others like us at the UN to help develop in digital architecture. And last but certainly not least is the importance of self-care and well-being, because for those of us on the front line of providing services and support, there's been a high risk of vicarious trauma. So as I come to a close, the paper that you will find in the chat box and the link online are as follows. For those in the field or on the ground working in civil society organizations, we want to recognize that you have really magnified the role of community volunteers, and that civil society need continuous support to help invest in the role of community volunteers. They have been so critical to the pandemic and response and the intersection with ending violence against women. And with that comes a whole barrage of questions and concerns about how to support unpaid care work of community volunteers, for example. What's come out of this is that we acknowledge the importance of ensuring the space and opportunities to care for the well-being and resilience of frontline responders, and that we need to access and we need to respond to the capacity needs of staff and stakeholders working to support women and girls. For donors, you've heard it today, you heard it from the panel. We need flexible, long-term core funding. We need to support women's rights organizations and civil society so they can adapt to meet the needs of women and girls through crisis. We need to invest in the resilience of organizations through their infrastructure, through their ICT, through their policies to support staff, and invest in digital infrastructure. And finally, as we're trying to bridge the gap between donors, researchers, and practitioners with our work, we call on researchers to look further into the impact of COVID-19 and other crises and what we can learn, and to do more research on adaptation, but through practice-based knowledge, through listening and learning from practitioners. And so to carry on this conversation, please read the paper, and you can see the QR code, the funky digital QR code on the right. You can use your mobile phone to scan that and go straight to the publication. Please join the conversation. So after this, go to Shine, and we would love to hear your voice on these 4 questions. So we can add to this paper, we can add to the knowledge, we can use it for advocacy and resource mobilization. Tell me if I'm wrong. Tell me if the findings are incorrect, if you have a different perspective. What is the impact of the pandemic and other crises in your context? How is your team, no matter whether you're a donor, a practitioner, or civil society, adapted? What are examples? How can we learn from each other? And what more resources do we all need to put in to help civil society be resilient to crisis?